Do you know that in the United States, the most recent paper I have shows that 91% of people are too fat for their health. That means basically everybody's sick. I mean, they're on the verge of having a massive heart attack, of finding a metastatic breast cancer, of developing kidney failure from diabetes. I mean, the common person walking down the street, they're sick. And you have to ask some really basic questions. When that many people are sick, you have to say, well, is there some kind of serious genetic problem? Of course not. It has to be something that we do in mass. It's the food. It's the food. Stop looking other places. It's the food. And if you eat a starch-based diet with fruits and vegetables, you will take care of most of your health problems, because most of them are due to food poisoning. Food poisons. I want to end my discussion here. It's hard for people to change. And I've worked the last 47 years to try and figure out how to get people to change. I've had nationwide radio and TV shows, written 13 national best-selling books. I've been at this intently. 3 different kinds of programs, residential and now a telemedicine program. And that's what I spend my time trying to do, is to get people to change. The first book we ever wrote was called Making the Change, because we knew change was the problem. So I try and simplify things for people. When it comes to destructive habits, like, for example, when it comes to problems with smoking, you've got only one poison to deal with. That's tobacco. Okay, so you got only one thing to change, and that's the inhalation of products of cigarette smoke. When it comes to alcoholism, you've got only one thing to change. There's only one other liquid you can drink besides alcohol. But when it comes to food, you've got everything from avocados to zebras that you can eat. And people get confused. And so what I've tried to do is make it simple for people. And so what I explain to them, like with smoking, there's one toxin. And with alcohol, there's one toxin. Well, with food, there are 2 categories of poisons. The first category is anything from an animal. That means any animal body parts or any animal secretions. And the second thing is free oil. In other words, corn oil, safflower oil, olive oil, etc. oil. So all you have to do is, like cigarettes, it's just one thing. Alcohol is just one thing. You only got 2 things to change when it comes to food. But I know some of you out there are thinking, oh, animal foods and oil, that's all I eat. That's all I know. Well, that's all you know until you learn about starch. And then all of a sudden, the whole world opens to you. And so I've tried to make it real simple for people so that they can make effective changes. It's not overwhelming. 2 food poisons. That's it. Fix them.
Amen. Let me just say, when we talk about people who are overweight or obese or fat, we're not trying to fat shame. We know just from our clinical experience that people who are overweight or obese age prematurely. They get all these chronic diseases. And the key way to reverse that is your food. As Dr. McDougall said, oil is not a health food. You definitely want to cut it out. It's a poison.
Dr. Helman.
I kind of smile when you say about fat shaming. I have a slide that I show. In fact, I'll be showing it during my next presentation next Friday. And it starts out by listing the different words that are used to describe somebody. I don't know what word to use. Overweight, fat, obese. I listed every word I could think of to describe this condition. I didn't find anything flattering. Should I call you roly-poly? Should I call you chubby? Should I call you broad in the butt? What should I call you? Nothing. Can't think of any word that comes out making me feel good. They all have a negative connotation associated with them. And that can only be because there is nothing good about being fat. Fat, by the way, is an adjective. Okay? Obesity is a disease. And overweight means there's a standard of an ideal weight that you're balancing against. So there are proper definitions for these terms. Fat's an adjective. Obesity is a disease, and overweight refers to a standard that you're not meeting. Every other term, you find me a term. I'll be on next Friday night. Find me a term that is flattering to people who are fat, obese, overweight, roly-poly, chubby. I can't find any nice words.
Dr. Helman, this conference I started like 11 years ago. And I started with Brian Clement. He was the first time we ever did it. It was just him for 3 days. And he's a friend of mine, and I've worked closely with him. Hippocrates has been a good friend of the real truth about health. But one thing that Brian says differently, it's only like him, Anna Maria, and Gabriel Cousins, and Thomas Seyfried. They claim that when they used to look at blood under the microscope at Hippocrates, they observed tumor growth in patients who consumed large amounts of fruit. And this observation led them to reconsider the role of fruit in their dietary recommendations. And he says that the modern fruit's been hybridized to increase its sweetness, and that the high sugar fruit content can lead to elevated blood sugar levels, which could be detrimental to individuals' conditions like cancer, where sugar can feed tumor growth. And so he's basically saying that if you have any kind of health issue, you should avoid sugar, otherwise no more than 15% of one's diet by weight. And then Thomas Seyfried at Boston College is saying that glutamine and glucose are the two things that feed cancer. So, in general, most whole food plant-based people are super positive about fruit. But I've asked this question many times to Brian, Anna Maria, Gabriel, and Thomas Seyfried, saying that glutamine and glucose are the fuels of cancer. There's nothing in the world I want more than to eat blueberries, cherries, peaches, plums, nectarines. It's one of the joys of life. Yet, if you're going to feed cancer, that would be bad. Do you have any clear insights on his perspective?
Just first
I
of
do.
all,
Yeah, go ahead.
Dr. Helman, do you remember glutamine as being a sugar? Isn't glutamine an amino acid?
It's an amino acid that you're
I don't know
exactly
how
right.
you mix up glucose and glutamine.
They're two
I don't
separate
see any
things.
connection at all.
They start with the same three letters, GLU.
They start with
Glucose
G.
and
So I guess we could
glutamine.
put God in the category, or goose. They have no connection. Look, the research shows that eating sugar does not, except immediately, does not raise blood sugar chronically. Even after 2 days, it doesn't. Sugar rots your teeth. It's empty calories. It'll raise triglycerides in sensitive people. It's not health food, okay? But it's not the two major food poisons that I just gave to you. It's minor food poison, just like salt is. You got to deal with the most important things to get on with really to get your health back. You can't go off on tangents that are relatively unimportant.
Right. No, I agree with you, Dr. McDougall. But first of all, I want to say, Steve, thank you for starting this conference 11 years ago. I remember going in person when this was in person in Orlando, and I lived in Orlando, Florida. And I remember commuting to the conference. I learned so much as a traditional physician. That's how I ended up going into more of an integrative approach. So you personally setting up this conference transformed my professional life. So that's number one. Number two, there's a nuance here. Here's the nuance. Number one is that it is true that, it is true that the fruits of today have been hybridized and modified in terms of having a higher sugar content than 100 years ago, right? The apples of today are huge. The common apples of 100 years ago were tiny. That part is true. But if we talk about cancer, now there are certain types of early cancers that get stimulated growth by a high sugar diet. And when I say a high sugar diet, I mean things like processed sugars, not whole fruits, not blueberries, but maybe, blueberry jelly preserves with lots of added sugar. So what I would say is, so that's certain types of early cancers can be promoted by increased sugar, but when you get to stage 3 or stage 4 cancers, often their preferred fuel is not sugar, it's fat. So I think what you were in your question, it's not the whole picture. It's not the whole nuance. So no, Steve, you should not, and the audience should not be afraid about eating fruit and blueberries and strawberries and bananas and apples. That should not be your concern. Your concern is you should be avoiding added sugar. Added sugar is not your friend. So yeah, that's my perspective.
Okay.
Well, this whole sugar thing has got a promotion because of the low carbers, the ketos, the carnivore diet people. They bastardize sugar because, of course, they have a program that makes you so sick you don't eat, and as a result, you lose weight. But this kind of approach increases your risk of dying of heart disease. I can show you 4 large meta-analyses studies that have come to the conclusion that eating a low-carb diet increases your risk of dying overall and dying of heart disease. I could show you a study that just came out. And in fact, Dr. Mercola, who I think you referred to just a minute ago, he changed his own personal diet as a consequence of this study published this year, which shows that people in my age group and Dr. Helman's age group, he's middle age, I'm old age. In our age groups, you increase your risk of cancer and heart disease and overall death by eating these low-carb diets. And that stimulated, as I understand it, Mercola to change his diet from keto to the diet similar to what we're talking about. So, they've done a bad thing to people. They're not just to people, but to the planet and also to animal welfare. Get rid of these folks. But the meat and
Okay.
dairy industry and egg industry are really happy with them.
Okay. I want to thank you both very much. If we could unmute the microphone so the audience can thank them.
There's something wrong.
Thank you.
Thank
We love you.
you.
So welcome.
Thank you.
Yeah, you're terrible.
Okay. Thank you,
Dr.
guys.
Helman
Thank you.
and Dr. McDougall, how does someone get in touch with you? What's the best way? Dr. Helman first.
For me, probably my website, which is drjosh.com, and my email address is drjosh@drjosh.com. Thanks.
Do you do private consultations to telemedicine?
I do, and just go to my website, drjosh.com, drjosh.com.
Okay, it's on our website also. Dr. McDougall, how do they get in touch with you?
Yeah, well, we're on all the social media, Instagram and Facebook and so on. But we have a website. It's drmcdougall.com. And plus, we're very, very well represented on YouTube. So if you want to hear a discussion, about the things we talked about today, Alzheimer's, diabetes, heart disease, cancer, and so on, I've got probably 200 lectures up there on various topics. So you just go to YouTube and put in McDougall and diabetes, arthritis, or et cetera. And you'll get a good free understanding. And by the way, on our website, drmcdougall.com, we offer a 12-day free program. No gimmicks. You can do the program. Everything's there for you on your own for nothing. drmcdougall.com.
Thank you both very much.